Hi, we're Drs. Andy and Brandon with Twin Cities Movement, and we're going to cover a few drills on breathing. So first, we are going to show a diaphragmatic breath. And so this is the kind of breath that we look for when we are talking about abdominal bracing. We want somebody to breathe into their abdomen. This is their diaphragm pulling the air into their lungs, pushing the vital organs out of the way, and it's basically pushing out. So then, if you could demonstrate a chest breath, please. So this is a chest breath. This is going to be using your accessory muscles, which when you're breathing heavily, when you're in the middle of activity, it's okay to be using those muscles. They're meant for that. But they're not meant to be primary breathing muscles. And this is what can easily lead to anterior head carriage, headaches, things like that, because you're activating your scalenes, your SCM, and your upper traps quite a bit. So we are going to now talk about a couple of drills that we can use to learn abdominal breathing. So first thing you're going to do is put your hand on your abdomen and then your other hand on your sternum, and you're going to take some breaths, not letting the sternal hand move really at all. You want to be able to experience at least enough control to be able to do this. This is not how you have to breathe all the time, but it helps to be able to control it for when you do need it. So if this is a problem, then we have a regression for it. I'll have you flip over onto your stomach if you would, please. So your forehead is going to be on the floor so that your nose is not mashed into the floor. And then you're going to take some breaths into your belly. Now you have automatic feedback. The floor is there pushing you away because you can't push into the floor. It's going to make your low back and your pelvis move. So this alone, if you have low back pain, this can be a really relieving posture for some people, and it is something that's worth trying. So after a little bit of time here, hopefully you should have enough awareness that you will be able to get back on your back and then move on to the hand on the stomach, hand on the sternum drill. But we're going to move on to the next one here. So I'll have you flip over onto your back again. And for this last one, this is going to be abdominal bracing. This is what we would like to do before heavy lifts. This is what we like to do when you're landing, after you jump off of a roof or something like that. It's a good way to brace, and it's a good way to brace with a neutral pelvis and with a neutral rib cage. So what you're going to do is you're going to take that abdominal breath and then you're going to bear down. So this is going to engage your transverse abdominis. It's going to be using your diaphragm, your pelvic floor, your small spinal muscles to create a canister. So this canister, you have your internal and your external pressure being equal in this canister, which is going to be doing the stabilizing. So the little tiny muscles in your low back and your erectors aren't doing all that work holding you up. And so then you're going to practice basically breathing behind the wall, as we call it. You're creating this wall and then you're breathing in and out. A lot of times people feel their rib cage move. That's okay, it's kind of what you want. A lot of people's upper backs are restricted, which means their rib cage isn't going to move very readily right away. But you don't want rib flare. If you would just go ahead and give a little bit here. So you don't want that rib flare when you're doing this. You want kind of almost a compression. So your rib cage goes down. And there's going to be a flatness here. This is not your typical six-pack. This is an all the way around sort of stabilizing strategy. So this is the next step that you take. You breathe behind the wall, and you do that 5, 10 times, 15 times as a warm-up, where you do it for 30 to 60 seconds before you move on to your regular activities. This doesn't have to be very extensive, but it can be helpful to really get everything engaged before you get on with your next activities. So again, this is Drs. Andy and Brandon with Twin Cities Movement. Thanks for watching.